So it's been about 2 months since I came to you all and did a video, and I wanted to come in and just check in and show y'all what I've been doing these last few weeks since my last video. I wrapped up my labor and delivery clinicals, which was nice. I enjoyed labor and delivery clinicals. The only thing that I didn't like was that my instructor was very knowledgeable about a lot of stuff. She taught us a lot of things. She gave us a lot of opportunities, but it was so hectic on the floor. We were in labor and delivery. Everything was very, very fast paced. Almost every day that we had clinicals was a very, very busy day. And we never had the opportunity to sit down and kind of soak everything in, because by the time we came there, we were running, doing stuff until we left. So you really couldn't let a lot of stuff register. You had to be very quick on your feet. It felt like that we actually were employees at that facility. And my instructor kept on telling me over and over again and telling my classmates that we had to do more. We had to be better. We had to be better than, the next nurse, because people already looked down on, black nurses. Everybody in my clinical group was, African American. So she just told us that we had to be better because, African Americans had to be better at their job. And she kept reinforcing it at their job as a nurse, or at their jobs, period. So she kept reinforcing it over and over and over again, and I was there to learn. I was there to learn, to soak in what was going on. When I came to clinicals, I wasn't trying to be better than the next white nurse or the next Latino nurse. I was there to be the best nurse that I can be. I didn't show up there to learn how to become a black nurse. I'm there to be a nurse. So I don't want to hear all the extra stuff all the time. Like, when I'm there to be the best that I can be at the job. I don't come into a situation thinking, and maybe I'm wrong about this, but I don't come into a situation thinking like I got to be better than the white nurse. I got to be better than the white person. I got to be better than this person. I got to be better than that third person. The only thing I'm doing is coming to do my job. With that mentality in your head that you always got to be better, it's almost something else that's deeper there, like you feel like you're inadequate or that you aren't better. So you're always striving to be better. My whole thing is that I'm trying to be the best nurse that I can be. I'm not trying to weigh and grade myself next to somebody else. But other than that, when she kept us running on the floor, Like, on our very first day, we witnessed a cesarean section. And we got a chance to sit in on the cesarean section. They had to rush, and my instructor told me, run to the front desk and get a razor to shave the patient and prep the patient, for whenever they were going to do the incision or whatever. So I ran to the front desk, and then I ran to go get the person's family whenever she was through with the cesarean section. And one of the nurses on the floor told my classmate, asked my classmate rather, why is he running around? And as soon as my classmate instructed me on what the nurse had said, or asked me why I was running around, I immediately got upset, because I really wasn't that amped about labor and delivery rotation anyway, but I was there to do my best. And the instructor kept telling us to run, and run us like maniacs. And then the nurse didn't like that, because she instructed my classmate that the only time they ran on that floor was during an emergency. So as soon as I saw the nurse, I told her, like, look, I'm only doing exactly what my clinical instructor told me to do. And I just simply walked away after that. Because I didn't want to argue. I didn't want to fuss about it. I didn't really want to be there on some days, because, like, I've enjoyed all of my clinical rotations. This has been my labor and delivery was my least favorite. And I was trying to make the best out of it, but it was so many things going on up there. It was so hectic that if you didn't like it, the stuff that was going on made it easy not to like. Let's just put it at that. But anyway, it's over. I'm through. I passed it. I passed this level. We were supposed to take a Hesi exam. Like I think I maybe told you all, we were supposed to take a Hesi practice exam to get us prepared for the Hesi exit exam, this next level. But some stuff went on, and we didn't get a chance to take a Hesi. We ended up taking Kaplan exit exam, or a Kaplan assessment on your nursing skills. And the Kaplan test was 180 questions. It covered everything from fundamentals on up to this point. So it was a lot of information, mostly med-surg. I think 120 questions, somebody said, was med-surg content. Anyway, we took the test just to see where we are with our knowledge. It wasn't supposed to count at all. It wasn't supposed to count at all. So a lot of my classmates just started clicking anything, just marking anything, because, you know, they were tired. We, long semester, stressed out. People just got to question 80 and started clicking anything. Well, I don't know if you all took a Kaplan before, but a Kaplan, some people tell me, is more geared toward NCLEX type material. But in a Hesi is not like NCLEX, but it's so hard and difficult that if you pass your Hesi exam, you should be able to pass your NCLEX, is what I'm hearing. So the Kaplan and the NCLEX exams have their pros and cons. And a lot of schools use Kaplan and, Hesi if I said, I don't know if I just said the Kaplan and the NCLEX, but I meant to say Kaplan and Hesi. Bear with me, y'all. It's kind of early for me, and my brain is still in the fog. But anyway, some schools use the Kaplan and the Hesi as progression exams throughout the level, and they take, you know, an exit exam at the end. Anyway, we took it, and most people scored like 50s and 60%, and the Kaplan is weird. It's a thing called a percentile ranking on there and your percentage. You can make a 72% on the test and have a 72 percentile ranking, as I did, or you can make a 72 on their test and have like a 36% percentile ranking. It's weird. It's like you can miss the same number of questions as somebody else, but the level of difficulty is different. So you might have gotten more harder questions right and got a 72%, where somebody else got more easier questions right and got a 72%. So your percentile ranking is going to be higher than them because you got those high level questions, you know, you got more of those right compared to the next person, which is just like, you know, on the lines of NCLEX or whatever. But yeah, a lot of my friends saw their score and they wasn't happy with their score. But remember, y'all, it wasn't supposed to count. So a few days ago, everybody's chilling at the house, and we get a message on the internet, and a lot of my friends go tell me to check it out. It says, "Congratulations on you all making it to 5th level," and all, you know, other kind of stuff. And it said, "Oh, and if y'all didn't make if y'all didn't make in at least a 51 percentile on the Kaplan exam that y'all took last week, y'all are gonna have to sign up for this, like, basically this remediation class in our next level." So everybody was mad about that, because keep in mind, the test wasn't supposed to count. We were told that the test did not count at all. But if you didn't make in a 51st percentile, you have to take a remediation course. And that's going to push some people over their hours. Like, financial aid only pays for like 18 credit hours, and some people are already up to 16. So when they add like this 3-hour, how many ever hour class that this remediation class is going to be onto their schedule, they're going to go over their financial aid hours, or the hours that financial aid have to cover, and they're going to have to pay for classes out of pocket. So a lot of people aren't too enthusiastic about that. But anyway, yeah, we're getting ready to, I'm just trying to enjoy my break. I've been studying every day. We've been out of school now for like a week. I'm just preparing for whenever we do get back, because a lot of changes are happening in our program, and we don't know if we're taking a Hesi exit exam to get out of school, or we're going to take a Kaplan. We have no clue. They don't know yet. If we do take a Kaplan exit exam, we'll be the first class, I think, ever at this school to take a Kaplan exit exam. So there's so many things that people don't know. And like I said, a lot of people are kind of disgusted about the Kaplan score, because as I told you all, I made a 72 percentile ranking, which was, you know, way more than that 51 percentile ranking that we need in order to get exempt from that class. So I'm happy about that. But most of my friends made like 15 percentile ranking, 20 percentile ranking, 30 percentile ranking. But you got to think that I have a lot of more history with some of this nursing stuff. I got a lot of this nursing content down packed because I came from another school. As y'all can go back and see, I started my first nursing program in January 2008. Got accepted December of 2007. And I remember making the video, being all enthused about that. there's been so many things in my life that has just went wrong in this last year and a half. And it's made getting to this point very bittersweet because of everything that happened throughout, you know, these last few months. From the passing of my grandfather to the, you know, passing of my dog. I loved my little bitty Pomeranian I had. And, you know, all my dog people can sympathize with me out there. When your dog passes away, it's like a part of your family. But just so many things has happened. There's just two things to name a few. But I'm also happy, I'm blessed to get to this point. I realized that without, you know, God being there and helping me, I don't think I could have made this far, because I gave up on myself a long time ago, and I just said, God, I put it in your hands. There's too many things happening, and I'm just struggling, trying to make it. I left my old associate degree program, working on my, you know, my RN, and I jumped into this BSN program. And if y'all go back and look at my old videos, you can get a little bit of history behind me, some of the newer people who are subscribed to me. It's just been a lot of stuff. A whole lot of stuff. And I don't even want to go into all this stuff because I'm trying to think positive. But just know that if I can make it, and I'm getting to this point, that whatever you're going through out there, you can make it. I've been put out of houses right before a test. Car broke down. Don't know how I'm getting to school the next morning to take an important test. It's been so many things, but I just push through it and I try my best. But yeah. We took the Hurst review right after I made my last video, and I would recommend taking the Hurst review. It is very, very good. This woman named Marlene Hurst made it up, and I recommend actually somebody taking it during their first levels, because we took it now in 4th level, and we're going to retake it again in 5th level, the Hurst review, which is like a 3 or 4 day review for the NCLEX. Marlene Hurst made the stuff very, very, very simple to remember. Like fluid and electrolytes, she summed it up well. Orthopedic stuff, she summed it up well. Oncology, she summed it up well. Cardiac system, which is one of my weaker areas, she summed that up well. So I would recommend taking a Hurst review. Yeah. There's just so many things that happen. So many things that happen. And I guess let me try to throw this in very, very quickly. Tell y'all this story. I'm going to try to make it fast. I was applying for a student nurse tech position at this, you know, hospital around here. Applying for the student nurse tech position. And I had been trying to get the job ever since like July. Trying to do everything to get the job. And I kept calling the lady in human resources about the job. And she kept telling me that the specific unit supervisor hasn't went through the applications yet to find, you know, out what student she was going to hire for the student nurse tech position in this pediatric emergency department job I was trying to get. Well, the lady was like, well, the supervisor hasn't started hiring people yet, so just give it a while. She gave me that run around for like 2 months. Finally, I broke down, called the unit, and talked to the supervisor myself. And she was like, hello, my name is such and such. And I'm like, okay. I told her what I was calling for. I told her a little backstory behind myself. And she told me, she was like, honestly, I haven't been trying to hire anybody because I put, you know, everything else on the back burner trying to hire the students for this area. I put everything on the back burner trying to hire just the nurses for this area. I haven't been hiring any other positions but the nurses. But she said, you know, since you're on the phone with me, when can you come in for an interview? I told her when I can come in for an interview. Scheduled the interview. A few days later, about 2 weeks later, I went to the interview and I took all my stuff. You know, I have a nice GPA. I had my transcript, just everything. I presented myself in the best light that I possibly could. And the lady told me that her brother had just, the woman interviewing me, she told me that her brother-in-law had just finished college. And he was kind of disgusted at the fact that every job that he put in, he wasn't getting called back. And she used me as an example. She told me that I told my brother-in-law that I had this student trying to get a job, and see, he has to be more like you. You put in for your job and you kept calling back for your job and you actively tried to get your job. So I told him that he has to be more like you. So when she's saying this, I'm feeling like, yes, I got the job. Like she saw that I was really actively trying to get this job. She used me as an example to her brother-in-law that this is how a person goes about trying to get a job and being passionate about a job. She told me that within like 2 or 3 days I should hear something about getting the position. 2 or 3 days pass. She never calls me back. Call her back, don't answer the phone. Call her back the next week to check up on a job, and she told me, I have about 2 more people, and I'm going to call you back and give you a decision on the job. Call her back the next day when she told me to, or the next 2 days that she told me to, or whatever. And she was like, you know what? I got to talk to the lady, the nurse recruiter in human resources that I told you all about first. She told me she had to get with the nurse recruiter in human resources and figure out who they were going to hire. And she was going to call me back and let me know. 3 weeks passed, I don't hear anything from her. I give up on the job. Because most people I talked to told me to give up on it anyway. They didn't see why I was pursuing the student nurse tech job that hard, or pursuing it that aggressively, and it's like these people are giving me the runaround. I let the job alone. I went ahead and wiped it off of out of my mind and just washed my hands of the job. One day I was with one of my classmates and I decided to give the lady a call, the nursing supervisor from that pediatric emergency department area that I called and got the interview with. I went ahead and gave her a phone call. And I said, hello. I said, yeah, I'm just calling. I had her on speakerphone. Yeah, I'm just calling to check on the job. And she was like, oh, yeah. Turns out that position was full. It was already filled. And I'm thinking to myself, how can a job position be filled when you practically told me yourself that I was the first person that you even interviewed for the job? The first person that you even looked at for the position. How can a job position be filled already? When you told me yourself, you put hiring student nurses on the back burner. I was like the first person that contacted you about the job. Then I asked her, wasn't there 2 jobs in that area? Because it has 2 jobs listed. I can pull up the job right now. The job is still listed. It's empty. But she told me, oh no, the job, it was full. And just up, and it was so like she didn't care. So fake. So just, I knew the job, I knew the position was still open. So I just left it alone. I've washed my hands with it. I'm through with it. Just to give y'all an example of how people are just, people are just dirty, and you just can't let stuff affect you. I made it up in my mind that I'm just going to focus on school for this last semester that's coming up because I graduate in May. I'm trying to think positive. I'm actually thinking about starting a new YouTube page after I'm through. I was thinking about starting it whenever January hit, starting a brand new fresh page, but I might wait until after I graduate to start the page. I don't know. But yeah, that's pretty much it. There's been so much stuff going on. I'm trying to give y'all just a little bit of synopsis of what has been happening since then. Oh, and I started watching, this is off subject, I started watching Trueblood. Now that I have some rest. I bought season 1 and 2 of Trueblood from Walmart during Black Friday for like $10 each, which was a deal because they still going for like $40 a piece each season. And I'm loving Trueblood. And it's funny that everybody is so country with all these different accents, and they're supposed to be in this place, Bon Ton, that's like supposed to be right around the corner from Shreveport where I'm at right now. And it's funny that they talk about Shreveport and stuff so much in the show. I'm liking it though. It's very, very graphic. It's definitely a show that's for adults, so I can't try to enjoy it with some of my younger family members. But Trueblood is kind of good. I'm on season 2, episode 4 now. And when I wrap up season 2, I know I'm going to rush out and try to get season 3 so I can get caught up on everything that's happening. But yeah, that's basically everything that's been going on with me. I'm trying to enjoy my holiday break now, but I'm studying every day because in nursing school, you can never take a break from anything. You always have to keep grinding. You always have to keep grinding and hustling and trying to make it. So yeah, I guess that's all I had to tell you all today. Thanks for the new subscribers that I have. If y'all have any questions, feel free to ask me. I always say that, and it seems like nobody ever asked me a question until after I post the video all the time, so I can't answer your question in the video. That's how it happens. So if you would send me some questions right now, right after you, when you think of me, right after I'm saying this right now, if you send me some questions, the next video I do, I can get those questions answered in them, if you have any questions. But yeah, anyway, before I start rambling on and on and on, I guess I will let you all go. And congratulations to everybody around the country who just completed their semester successfully, because I know that pretty much everywhere school should be getting ready to be out for break. So congratulations, sit back, chill, relax, but get ready to hit it hard whenever the semester starts back up again. So yeah, until I make another video, I will talk to you all later on. Bye.